What are the new developments in diagnosis of food allergy?
The most important new development in food allergy diagnosis is availability of molecular diagnostics and having the ability to measure specific IgE against the major allergens. This has been very helpful in a better characterization of the phenotypes of food allergy, particularly in relation to the plant foods such as peanut or hazelnut, where there is a significant cross-reactivity with the tree pollen, and having being able to determine the profile of the patients, the sensitization either to the peanut-specific allergens such as RH2 or to the cross-reactive allergens with birds such as RH8 helps us to distinguish between those patients who are at higher risk for systemic reactions, those having RH2 antibodies versus those who are at low risk for systemic reactions and who are mostly asymptomatic or have just mild oral symptoms, who are predominantly or exclusively sensitized to RH8. But it is also helpful for diagnosing other food allergies and in particular in determining reactivity to baked milk and baked egg in children. Those children who have IgE antibodies to caseins and to ovomucoid, which are heat-stable allergens, tend to be more reactive to the baked forms, and conversely, children who have very low levels of antibodies to those major allergens tend to have much higher chances of tolerating baked milk and baked egg diets.
How will this affect patients in the future?
Well, I think it's affecting patients already, but hopefully with the characterization of larger numbers and of those major allergens, the components, as well as the studies that will further define the association between the specific IgE levels to those components and the clinical reactivity, it will tremendously help facilitate our management. It will help identify patients who are optimal candidates for all food challenges. This will identify patients who will be the optimal candidates for future treatments for food allergy. For instance, if we can identify the biomarkers of persistent food allergy, this will identify patients who are in need for immunotherapy. So this will definitely, it's already changing the landscape of the management. So for instance, before, if the patient had elevated IgE to peanut, to the whole peanut, over 15 kilounits per liter, we would say, well, you have a very high risk of reacting. And in our practice, in our hands, we would defer our food challenge. Now, with the ability to look at the specific components, if we see that this patient is solely sensitized to RH8, which is birch tree cross-reactive, we'll offer a challenge to that individual. And it makes a tremendous change or difference for their quality of life, knowing that their allergy is mild or they're not allergic at all. So, and on the other hand, knowing that they are RH2 positive, for instance, this really validates their effort at avoidance, and I also encourage them to seek treatments for food allergy.
What is the take-home message for allergists and primary care physicians?
Well, I think for the allergist, it's something to become familiar with and understand the utility as well as the limitations of this approach to diagnosis, and also understand that this is really helping us to identify better identify patients who are best candidates for all of oral food challenges, and should encourage allergists to consider this diagnostic test in their practice. I think it's too early for the primary care physicians to really utilize the molecular diagnostics. Maybe in the future, when we have really, as allergists, have really studied this extensively, and we really define the diagnostic decision points for components, because it's not a question of positive, negative. It's a truly similar association. There's an increased probability of reactivity with the higher levels, and this has to be still better understood in terms of what's the clinical applicability.
Where is this type of research heading in the future?
Well, I think it's going to continue with identifying more of the specific allergens for a variety of foods, such as we mentioned peanut and hazelnut, as well as milk and egg. But this is true for any other food, and we really need the biomarkers, for instance, that will identify patients who are at high risk for anaphylaxis from wheat, or from soy. And this really helps us understand the pathomechanism of the, or pathophysiology of the disease, and will also help understand the changes, immunologic changes occurring during the immunotherapy. So this is a very exciting field.